welcome to PHI, Public Health Impact. I'm Phaedra Corso.
And I'm Cham Dallas. In today's episode, we're going to find out about improving something individually in our lives.
So the quest for improvement is so great in our society. We're always trying to improve something about ourselves, whether it's eating more healthy, whether it's running faster, whether it's watching less television. Today's show is really going to show us how we can make some of those important changes.
That's right. As consumers in a rich society, we've come to expect the best, whether it's as service providers or individuals receiving services. We want quality. We want the best.
But even if we want the best, it's not always easy to get the best, right? Or to deliver the best. So in today's show, we're going to learn about the methods and tools to get us where we need to be.
Our topic today is quality improvement. Dr. Darcey Terris, Assistant Professor in the Department of Health Policy and Management, will be joining us. And Phaedra is going to be talking to students working in this area of quality improvement.
And you know, they're really going to show us how there's a science behind quality improvement, and there's this whole process of change, and they're going to show us how these quality improvement methods that are scientifically based can be applied to improving your own self or to the healthcare system.
Now, following that segment, Phaedra is going to be talking to a number of students actually working in this area who came up with a personal improvement project. I'm looking forward to that. I think I'm going to have to come up with one for myself by the end of the episode. And we'll watch them as they go through this process of changing some important aspect of their life.
And then Darcey's going to come back later in the segment, and she and her students are going to show us how they've developed a quality improvement manual that is for use in the healthcare system. So it will be nice to see an application to health.
I think this is going to be really interesting as we watch these students go through this process of change from where they are to where they want to be.
That's right. So whether you're interested in keeping that New Year's resolution that you made, or whether you have a new quality improvement plan designed for yourself, this show is going to help us figure out how to make those quality changes. We're now being joined by Dr. Darcey Terris, who's in the Department of Health Policy and Management. And Darcey is really our resident expert on quality improvement. I've got to tell you, Darcey, I think quality improvement is a buzz term. I hear a lot of people using it, particularly in the private sector. Can you give us a broad definition of quality improvement?
I think actually it's quite difficult to give a broad definition of quality improvement because the definition of quality or improvement is very context specific. What I really think about in quality improvement is how can we create learning systems? So systems that continually reflect and look at where opportunities are or gaps are that they can address. I think what you want to improve or what I want to improve are very different things.
And so I know there's methods, there's a science behind quality improvement. What are some of the methods that one might use in assessing whether you've improved quality or not within your healthcare system?
Well, I think it's important to think strategically and to do a strategic analysis of where your organization is. One tool to do that, one very simple tool to do that, is to perform what's called a SWOT analysis.
And what does SWOT stand for?
SWOT is strengths, weaknesses, opportunities, and threats. And it's really looking at your system, your organization, and looking at what internally are the strengths and weaknesses of your organization, and then looking at the external environment and identifying what opportunities and threats are there. So it's looking at this in a very holistic manner so you can identify opportunities for improvement.
Okay, let's use the SWOT as an example. Give me in a healthcare setting, let's say it's a physician's office, what would be an example of the SWOT analysis within a physician's office?
Well, for example, you might look at strengths being the, say, team atmosphere within the physician's office, that there's a great coordination between, say, the physician and perhaps a physician assistant or nurse and the front-end staff who receive patients and process bills. A weakness might be that they're understaffed, that they really need additional staff members, or that they're in a location that is difficult to access. When you're looking at opportunities and threats, there may be an opportunity that they could expand and perhaps open a satellite office in another location. A threat may be that they have to deal with impending changes in regulations or healthcare reform that really makes them have to change their practice in certain ways.
So let's talk about other methods that one might use besides the SWOT analysis in healthcare systems when they're trying to make improvements.
Well, I think if you're talking beyond, say, the strategic evaluation, and there's certainly other ways that you can look at strategic planning and doing this kind of strategic evaluation, the next step really would be to identify a specific area that you want to address, and then go through what is called a root cause analysis, or the 5 whys.
Okay, tell me, what are the 5 whys?
Well, the 5 whys are, why is the situation here? Why is this opportunity here? And then you have to ask this question 5 times. So you come up with 5 reasons, and then for each of those 5 reasons, you ask why 5 more times. And you do that so that it becomes almost like a tree, so that you get to the roots of the cause. It's very easy for us to essentially address symptoms, but not address the root cause. And so it's important to ask why over and over again.
Okay, I think I have an example for you, and help me think through these whys.
Okay.
When you have medical errors that occur in a hospital setting, how might you apply the 5 whys to that type of?
So if you look at the first level of whys, you might say this medical error occurred because the nurse did not do what she was supposed to do. And then it's very easy to blame the individual. But then you say, well, why wasn't she able to do what she was supposed to do? And maybe that's because she has too many patients, her workload is too high. Or maybe it's because there's not systems in place to remind her. So when you come up with the first why, she did not do what she was supposed to do. Then you say, why was she not able to do what she was supposed to do? If there was too much workload, then why is there too much workload? Well, because there's been too much absenteeism, and we really need to have PRN nurses come in to fill in when we have absenteeism. So you get down to this root cause, and you can address the root cause, not this very surface level where you might address it once, but you're going to still have these errors repeat and repeat if you don't hit the roots.
Yeah, I love it. So you're kind of drilling down to the real cause of the situation. Right. In your class, I know you teach quality improvement in the spring here at UGA. What kinds of projects do you set up for your students so that they can learn about these processes?
Well, they did have to do a kind of critical literature review, and that was just so they would understand what was out there in the literature. And we did come back then in class, and they had to identify kind of the one lesson that was learned from the literature review that they did. And again, it's very interesting to see that these lessons in some sense are very common if you can generalize them. You have to be able to reflect in a non-judgmental fashion so that people feel that they have the ability to identify problems. We also, as a group, the students put together a quality improvement manual, and they did this as a group of 17 students, and they had to identify the target audience for that manual.
Okay, so I think we'll be talking a little bit more about the manual a little bit later in the show, but I do want to ask, before we go any further, are there any other methods? You've talked about root cause analysis and you've talked about SWOT analysis. Are there any other common methods people use in QI assessment?
Well, I think the most common model to look at making improvements in a continuous fashion is the PDCA or the PDSA cycle.
Okay.
And it's actually called by 2 different names depending on how far you go back into the literature and who named what. But it's basically plan, do, study, act, or plan, do, check, act. But it's the same principles. Basically, when you're thinking about addressing one of those root causes that you've identified, you need to plan an intervention. What are you going to do to address that? You actually have to implement that intervention. You have to study and see what happened. And then the most important probably is act, which is learn from that whole process, identify how to anchor that so that you can maintain what improvement you've achieved. Or, sometimes you don't actually get what you think you're going to get, and you have to learn from that and then go through another one of these cycles. So the PDCA or the PDSA cycle is something that should be continually repeating within an organization.
Continuous improvement plans or
Continuous improvement plans.
Okay.
So certainly this is one of the things that's been introduced in the manual. Our group of students this year, this semester, decided to focus on primary care physician practices in rural Georgia. So in settings where resources are constrained, but really the things that I've talked about require time and people's involvement, but don't necessarily require a lot of money to actually implement. And I think that's one of the things that sometimes is overlooked in quality improvement.
Darcey, next we're going to be talking with some of your students about their personal quality improvement plans and also about the quality improvement manual that your students developed for healthcare providers. Could you set up for us what exactly you asked them to do as part of your course?
Right. The third assignment or product that they had to produce was they had to do a personal quality improvement project. So they had to think of themselves as a system and go through the steps that we've just talked about, doing a SWOT analysis, a root cause analysis, and then going through at least one PDCA cycle. If they're going to go out as public health professionals and ask others, organizations and others to improve, they have to understand the challenges of going through that process. We also in the class specifically talked about how to apply quality improvement at the individual, provider, and organizational level.
Jaynae Kearney, tell me about your QI project that you did for the class.
Okay. Well, I did a food journal and I wanted to record my diet, so I kind of wrote down everything that I was eating and drinking and snacks and things like that. So even the cookies I had to write down. And I took data on that and wrote down dates and times, and I tried to do the quantity servings and things like that.
Okay, and what kind of quality improvement objectives did you have as part of this project?
Well, I wanted to increase my snack intake to two times a day, and then I wanted to do 3 balanced meals a day, so that was the main objectives, and just to write down if I was reaching those goals and things like that. And I also wanted to make sure I was doing the quantity servings and like portion size, so that was one of the bigger objectives too.
And so I know as part of this class you have to do an analysis, and so what kind of analysis did you do with all these data that you collected?
Well, I broke down my assessment into a PDCA cycle.
Okay, and what did you learn from the analysis?
Well, I used a Pareto chart to do the food groups, and I learned that I don't eat enough fruits and vegetables, and I eat way too much dessert. So that was a thing.
You and I both.
Yeah, that was what I found out, and I needed to eat more fruits and vegetables. And actually, the online assessment actually said that I need to eat more fruits and vegetables, so that was complimentary.
And so I'm guessing, is that the most significant thing that you learned, or what did you take away from this project?
Well, the biggest thing was that you don't actually have to have necessarily a bigger goal in mind, that I used my food journal as a baseline to say where do I need to start instead of what do I need to improve right away. So kind of just give me information on the baseline and what I need to do instead of what I need to fix, basically.
And now my most important question for you is, are you going to continue to do the food journal now that the class is over?
I haven't decided yet. I want to, but with time constraints and everything, I don't know yet. So we'll see.
Okay, great. Thanks very much.
Thank you.
We're now being joined by Meredith Lynch, who's another student of Dr. Terris's, and she's going to tell us about her quality improvement plan. So tell me, Meredith, what project did you have for this semester, and why did you choose the project?
Okay, the specific project that I chose to do was tracking my food intake into a daily journal. So what I did, I kept a journal and I tried to have 3 meals and 2 snacks every day. And the reason I chose this was not for a weight loss or diet purpose, it was for keeping your metabolism up. So that's basically, a lot of health advocates have said, eating small meals throughout the day helps keep up your metabolism. So I chose that, and what I did, the 3 meals and 2 snacks per day, they were 1 point apiece. So a perfect day tracked in my food journal would be 5 points.
Okay, and did it tie to any outcomes? Like, so you're keeping track of the 5, but what was your goal here in doing this other than the metabolism piece?
Okay, so I also wanted to look into keeping the food journal. Did it help me feel better physically and mentally? So did I feel better that I was writing down my food? Did I change what I was eating because I was writing down my food? So those were the two main reasons, on top of the point scheme system, why I chose to do the food journal.
Okay, and what did you learn in this process?
So what I learned in keeping the food journal was that the goal needs to be a little more specific. So I chose just to write down food. It didn't matter what I was eating during the day, though.
So you could be eating 5 pieces of chocolate cake and you get the same points if you ate 5 pieces of fruit.
Correct. So what I decided and I thought about is that it needs to have a little bit more specific fruits, vegetables, more water, less cake, less Mountain Dew, something like that, to help continue with a personal improvement process.
So it sounds to me like you're going to continue on with this food journal?
Yes. So with the original food journal that was done for the class, I did a plan, do, check, act cycle, which helps you evaluate your project. And it was a 3-week process. So I completed the food journal in class, then I looked back and did the plan, do, check, act cycle. So what I've started now for continuing the process is May 1st, I started to keep another food journal with the more specific goal of more fruits or vegetables, that I'm trying to have one every day.
So are you going to continue this on forever, or when do you stop?
Okay, so what it's going to be, it was a 3-week process in class, so I'm going to do the same 3-week process. And I'm going to go back and evaluate it with my charts, my diagrams, analyze all that, and see what I've changed. But I can say I'm definitely not going to write a report on it.
Yeah, I don't blame you.
No.
Well, good luck to you, and thanks very much.
Thank you.
We're now being joined by another student, Mike Friedline, who's going to tell us about his project. Mike, thanks for being here today.
You're welcome.
What quality improvement project did you do, and tell us why you chose it?
I was addressing my running performance. I've been running since I was 16, but unfortunately the last 7 years my running has gotten slower and slower and slower, which has been very frustrating.
Yeah, but isn't that just an aging process? I mean, shouldn't we expect to get slower as we get older?
Not as much as what we think, and certainly not as slow as I've gotten. Looking at it, I realize it's been much more about the injuries I've had over the last 7 years than my actual age.
Okay, and so as part of the quality improvement project, what exactly were you doing? Were you just keeping track of your times every time you ran, or what was the process?
I was keeping track of my pace, how far I was going, and I was trying, and I kept track of my miles a week, miles a month, but I also varied the training so I could prevent injuries.
Okay, and what were your goals?
My goals were to beat my best times from 1998 in the 5K, 10K, half marathon, and marathon distances.
All right, well, this was just a semester-long project. Were you able to run all those races this semester?
I was able to run the 5K, the 10K, and the marathon.
All right, how did you do?
I did outstanding.
Really?
Yeah, I beat my 5K time, my 10K time, and ran the best marathon I've ever run in my life. In fact, it was a personal PR.
Wow, congratulations. And so what is your take-home message here with the process? I mean, I know as a sometimes runner that I always keep track of my time anyway. So what does this process give you that's beyond just keeping track of time?
The process helped me look broader at how I approach running, to think each run in terms of the purpose behind it, whether I was trying to develop my lungs, my ability to run fast for long periods, or just building up my endurance, or to recover from those other runs.
And so it sounds like you just had a very successful time at the project because you improved your time. Do you have plans to continue this along, this keeping track of things?
I've got it all set up for the rest of the year and hopefully keep going from here.
All right, what are your personal running goals coming up in the next year or so?
My big goal is to qualify for the Boston Marathon this fall.
Excellent. So we've talked about application of the quality improvement model or process to your running. Do you see any applications to your professional life at all? And also tell us what you do for a living.
I'm an alcohol and drug counselor at the University Health Center, and my job is to help people change. And this was all about personal change, and so it's very applicable what I do, and help students look a little broader at how they're going about making those changes.
Great. It's a great example of how these quality improvement processes can be used in the healthcare system. So that's
Exactly.
wonderful. Thank you very much.
All right, thank you.
With me now is Barbara Gaston. She is a student in Dr. Terris's class who was part of the development of the quality improvement manual that they'll be using for healthcare providers. Barbara, I want you to tell us a little bit about this manual that you developed. First of all, what is the purpose of the manual?
Well, the purpose of this manual is to be a resource for healthcare providers, just to help them run their businesses more efficiently and effectively.
Okay, and how did you as a class, I know you did this for a grade, but how did you choose this as your project and not something else?
Well, we didn't want to just do a class project. We wanted to do something that would be a service to the state and not every healthcare provider has the resources to go out and bring in a quality improvement firm to help them analyze their practices. And so we thought this would be a great way, a very accessible way for healthcare providers around the state to learn about quality improvement methods.
Wonderful. I love projects that can actually be used in practice. That's great. Now, let's just imagine that I'm a healthcare provider in rural Georgia, let's say Moultrie as an example. What's in the manual that would be useful to me? So just give me a generalization of all the chapters in the manual, or a few of the chapters in the manual.
Okay, there's lots of different chapters in the manual. We really tried to cover the whole spectrum of quality improvement. There's chapters from things on leadership, money management, and chapters like mine, public relations and marketing. So we tried to cover everything.
Okay, great. So let's talk about your chapter specifically, which is marketing. Give me an example of what a healthcare provider would learn from reading your chapter.
One of the main things I focused on in my chapter was to really focus on the needs and wants of your community before you start a marketing program. Once you reach the point where you truly understand the needs of the community, it's important to let the community know that you understand their needs and are there for them. And at this point, public relations really comes into the mix. And one example of, a way to improve your public relations or standing within the community, gain the community's respect, is to have informational days, have open house days, or to even host events in the community sponsored by the healthcare provider, and that can really get the community involved and give them information about what you're doing.
So what is the most important thing you learned from developing this manual, maybe your chapter specifically, but what did you take away from this project learning?
Really, the whole quality improvement class and this project specifically was almost a very sneaky way for us to really learn quality improvement in depth. Obviously, each person got a little bit more in depth in the chapter that they focused on, but I came away from this learning so much more about quality improvement than really I thought I would at the beginning of the semester, and it'll be a great resource that we can have to distribute as a service to the state.
Absolutely. You've developed another tool, another public health tool
Yes.
that you can now go out and use as a practitioner in the future. That's great. Thank you very much.
Thank you.
Now, Darcey, we just heard from one of your students about the quality improvement manual that they created for healthcare providers. Can you tell me what were the overall objectives of that manual?
Well, many of the quality improvement tools that we've just discussed are actually fairly easy to implement. But unfortunately, providers, especially in resource-constrained settings, perhaps haven't had this training. So it's really a way of making these tools and processes very accessible.
And the student told us about her chapter in particular, which I believe was marketing. What else is in that manual?
So the manual deals with not only how a healthcare provider can improve service delivery, the care he provides to patients, but also how they can improve the performance of their practice to make it run more effectively and efficiently. In addition, one of the students developed a companion pamphlet for patients who attend those practices so that they can be an active participant in ensuring that they receive the highest quality of care.
Oh, it's great that they've developed something that actually has practical use. So are we going to be able to make this available to healthcare providers?
Our hope is to get feedback specifically from providers in rural Georgia, and then to actually publish it and make it widely available.
Wonderful. Today we had a really great, thought-provoking show. And we want to thank Dr. Darcey Terris from the College of Public Health teaching us about quality improvement, along with many of her students.
We saw we can apply the tools of quality improvement in our personal and professional lives. And we also saw how this can be used to actually better our own development.
You know, I thought the student interviews were particularly revealing. They showed a wide range of how you can apply quality improvement to your own life. And they also showed how sometimes you learn something that you intended and sometimes you learn things that were unintended.
That's right. Things don't always go as we plan or expected. We need to make adjustments along the way, particularly when they're making improvements in their own life.
And I'll tell you, in my own life, when I graduated from college, I had lots of debt, like many college students, and I really had to do the same step-by-step approach to try to get that debt eliminated. Fortunately, I was successful in doing that, but you know, it's a real process involved.
Yeah, well, as promised, you know, that was a great example in the past. I said at the beginning of this episode, I felt compelled to come up with my own quality improvement plan, and I've decided mine would be communication, personal communication with this busy professional lives we have, communication with my wife, communication with my children.
I think that's a great plan, and maybe what I'll do is come back to you in a couple of months, maybe your family too, and see how successful you were.
Okay, well, that's all we need is accountability in all aspects of life. I'll have to say, though, that the development of that quality improvement manual was really creative. I was very impressed with that. I think it's a perfect example of how we use public health innovation to make lives better.
The Quality Improvement Manual for healthcare providers in Georgia, to me, is a great example of how students are engaged in a classroom setting and creating a project for a grade, but then we can actually use that project as a service to the state to actually improve quality within healthcare organizations. It's wonderful.
Well, you can see the website here on the screen, and if you want to participate in this or get the Quality Improvement Manual, that's where you can get it.
So thank you for joining us today, and we look forward to seeing you next time on PHI Public Health Impact.